Hello and welcome back to Living with Wegeners. I'm Wanda, and as I shared with you on the last video, I was diagnosed with Wegener's granulomatosis. And on this video, I said I would share the treatment because it was a whole nother story. As you know, my disease is usually treated for Caucasian older men, and clearly that's not me. So the doctors really didn't know how to treat me. So they sent me to a specialist, a rheumatologist, who was very familiar with the disease. He just wasn't familiar with how to treat a black woman as opposed to Caucasian men. He was able to tell me all about Wegener's, how it was an autoimmune disease, that I would have it for the rest of my life, but it was treatable and it could go into remission. So the first medication that he described to me was a cancer chemotherapy pill called Cytoxan. And he said this was the best thing they had to counteract the effects of Wegener's and to attack the disease. However, it was bad because it attacked other parts of the body as well. Some of the side effects were nausea, vomiting, loss of appetite, stomach pain or stomach upset, diarrhea, wounds that don't heal, missed menstrual periods, changes in your skin color, changes in the color of your fingernails, and hair loss. The other medication is prednisone. It's a steroid drug that's used to suppress the immune system and also to reduce the inflammation in the blood vessels. I call it the wonder drug because it gives you lots of strength. However, there are a lot of side effects too. Weight gain with fat around your abdomen, a round face, high blood pressure, risk of infection and osteoporosis, memory loss, behavior changes, psychological effects such as confusion, trouble sleeping, and increased sweating. Next, to counteract all the side effects from those drugs, they gave me additional medications. So iron, calcium, potassium, high blood pressure medicine, along with a nose rinse to rinse the crust that was in my nose from another part of the disease. Those of you that haven't noticed, I always said that the disease ate the bridge out of my nose, but it causes a weakened cartilage. This disease does in the nose area. Out of all the side effects, the only one that really affected me was the loss of my hair. I really didn't want to lose my hair. And I know to some of you it may sound vain, but I just didn't want to lose my hair. My hairstylist told me she would make me a wig from my hair that fell out, but I just didn't want to lose my hair. Now, I must admit to you, I am a woman of faith, and I knew that I was going to have to go through this trial for whatever reason, but I just asked God if he would please spare my hair. I would take all the other side effects, but I just wanted him to save my hair. And as you can see, he did. This is what I looked like before Wegener's, and this is what I look like during Wegener's, and this is me now. Back to the treatment. So the doctor said I would be on Cytoxan for 6 months. And then after that, they would transfer me to a different drug that would maintain the disease after the 6 months. He also said I had to get blood work every single week as they monitored me on the medication. And at the time, I was too weak to drive, so one of my friends had to drive me to the doctor every single week for them to draw blood. Next, my nose pain was off the charts. My nose used to hurt so bad, and he referred me to a nose specialist. And oh my goodness, the tools that she used to go down in my nose to get the crust and the other stuff that was happening down there was unbelievable. You wouldn't believe it unless you saw it. So the nose specialist, then my eye was hurting. So my eye was like, my left eye was red and white. And it stayed red and white all the time for like a whole year. And every day it was in pain. And it had gotten to the point where it felt like somebody was stabbing me in the back of the eye every single day. I could be having a conversation with you and my eye would be hurting just that bad. They referred me to an eye specialist. And none of the medications, nothing they had given me, not the Cytoxan, not the prednisone, nothing took the pain away. And so I learned to live with it. And nobody should have to do that. Worse yet, At the end of the 6 months, I didn't get any better. And they tried to transition me to a different medication and it didn't work. So I wind up being on Cytoxin for an entire year instead of the 6 months that normally people were on Cytoxin for this disease. So of course, during that time, during that year, I did have the side effects. It started with my face. My friend Terry used to tell me that I had a heart-shaped face. And so the medication caused my face to go round and I wind up having the moon face. I also wind up picking up weight. Now, when it first started, I was 80 pounds. But at the height of my prednisone, I gained 100 pounds. So I was 180 pounds at my heaviest. When I first started prednisone, they put me on 100 milligrams of prednisone. Now, I felt like Wonder Woman, but the first 4 days, I did not go to sleep because I couldn't sleep. I was wide awake for 4 days straight, and I cleaned every nook and cranny of my condo. Don't try that at home. But it was just that powerful. And so when I called the doctor, he was like, oh no, you have to come back in. So they had to give me sleeping pills to counteract the side effect of that part of the prednisone. The other thing was my nails turned black. And I used to keep my hands closed when I would talk to people so they wouldn't see that my nails were darkened. Treatment? Yes. Difficult? Yes. But I was still alive and still fighting this awful disease. As the years progressed, I began to learn how Wegener's affected my body. Whenever there was a flare-up, my left eye would hurt even more. My nose would start tingling like a little fire starting inside my nose. And I would start getting weak and I couldn't walk. I would get tired just walking from the bed to the bathroom. And I knew that Wegener's was flaring up. On one of those times, my doctor asked me if I wanted to try a new drug that they were working on for Wegener patients called Rituxan. And he said it was in the experimental stages and a few people had died during the trial. And I was like, absolutely not. I will just keep taking the Cytoxin. I'll deal with the side effects, but I'll still be alive. And so he said, okay, and I didn't do it. I continued on with the Cytoxin treatments. 2 years later, I didn't have a choice. My Wegener's had flared up and it was really, really bad. I was in so much pain that I thought I was going to die. It was just that bad. And this time when the doctor called me in, he said, Wanda, you are too far along. Your inflammation is too high and you're not going to be able to take the chemo pill, the Cytoxin. You're going to need to do the Rituxan. The Rituxan was intravenously, and so the treatments were 4 treatments. The first treatment was 6 to 8 hours. The second and third and fourth treatments were all 4 hours, but I would have to do it all week after week after week. And that first one was so crucial because when people were dying, it was within the first 24 hours. And I was scared to do the treatment, but I was in so much pain, I did it anyway. And for me, the Rituxan worked. For me, it actually didn't have any of the side effects that Cytoxin had, and it was so much better. The worst part of the Rituxan for me was getting the IV and them having to move that IV for every single treatment. The other thing about the Rituxan is it's supposed to last for 6 months, and then you have to get another one every 6 months. And that was one thing that I did not want to do. And so on the next video, I'll share with you some of the lifestyle changes I did in order to not have to get that shot and that Rituxan every 6 months. And I even went so long as a year and a half, and as long as 5 years in remission, not having to do Rituxan. But before I go, I have to remind you that chronic illness is not the same for everybody. Everybody's body is different, and you have to learn how your body is affected in your illness. Whether it's a chronic illness or a small illness, you have to learn your body and how it reacts in those instances. The other thing is you gotta know the side effects. The commercial will tell you all these wonderful things that the drugs do, right? But then in a very small voice, they'll say the side effects may include dizziness, nausea, vomiting, weight loss, weight gain, thoughts of suicide. Like, what in the world, right? So remember that it is a medication and they do have side effects. Most medications, they give you a list of the side effects. Sometimes people just throw them away. Read them so that you can be very prepared for the medication that you're going to be taking, and you'll know what the side effects are. And until next time, take care of your body, listen to your body, and I'll see you soon.